Hello, I am Dr Suparna Banerjee from Ankur Fertility Clinic, New Alipore. Today let's talk about a very common topic, polycystic ovary syndrome or PCOS. This is very common and very pertinent nowadays. Many of my patients come to my clinic with a diagnosis already they have made. Doctor, I have got polycystic ovary disease. Sometimes it is correct, sometimes it's not correct. You need to understand that though it is named as polycystic ovarian syndrome, so it is basically a syndrome consisting of many things, and there is no cyst at all in the ovary. The cyst is kind of a misnomer. These all are growing or budding follicles. They are scattered. Usually follicles are scattered in your ovary cortex or the outer layer of the ovary. Here, what is happening in polycystic ovary syndrome, the normal follicle development is hampered. So follicles are not developing properly. They are all in the same size and sitting in the cortex or the outer layer of the ovary. So patient is not having ovulation, so no period. So this is the main features. Patient comes to us as a gynecologist, we see that is, I do not have period or have a very irregular period. Now, as I told already, it is a syndrome, so it consists of some other features as well. So one is clinically, they do not have proper cycle, sometimes only withdrawal bleeding, or when your doctor gives you some medication, you take the medication and only then you bleed. So that is, we call it as withdrawal bleeding, or sometimes you have bleeding but it is 45 days interval or 60 days, that is 2 months after period is coming. So this is a cyclical problem because ovulation is not happening. So body's biological clock is not working properly. So it is a metabolic syndrome is associated with this. So main problem of this polycystic ovary is insulin resistance. So insulin is a very key hormone to metabolize our carbohydrate, and it helps us to prevent diabetes. So because it is a problem of insulin resistance, so these polycystic ovary patients are very prone to develop diabetes, and that has got a long-standing implication. Suppose if you are in your 20s and you have developed diabetes, so you have to control the thing very, I think, stringently, otherwise your long-term life will be hampered. So chance of diabetes basically is very high in this group of patients. So it is my lifestyle disease as well, because as we know that diabetes, hypertension, all this hypercholesterolemia, all are lifestyle dependent disease. So polycystic ovary is also partly it is familial, that is, it has got a genetic predisposition. Partly you can say it is ethnic, so we Asians are more prone for developing diabetes, and lifestyle disorder as well. So basically you need to, what is in your hand is you're controlling your lifestyle. So low diet containing low carbohydrate is helpful for this group of patients, and you're maintaining your body weight. So usual body weight BMI or body mass index, we say 25, but for Asians it is 23 actually. So if we are more than that, then we are first overweight, or if you are crossing 30 BMI, then you are obese. So to cut down your carbohydrate and fat, switch over to healthy food, avoid the outside or takeaway food because it contains too much of carbohydrate and bad fat. And then healthy lifestyle, some exercise to maintain your body weight, to maintain your body mass index in 25 or 23 range, then you can avoid the bad side effect of this polycystic ovary, and especially the diabetes, hypercholesterolemia, high blood pressure. And other thing they have is some external changes of the appearance like hirsutism or excess hair development in like mustache, or some coarse hair in your hand and legs, lower abdomen, sometimes chest, acne in your face and chest and back. So these are very common features of polycystic ovary, and we are now seeing this is quite rampant. So from the age of puberty, patients are presenting to the clinic with this kind of external appearance, periodic problem, and so you need to control the disease and its metabolic part very stringently from that part, because the whole life is left. So if you want to keep yourself healthy, disease free, you have to control your diet pattern, do some exercise, keep yourself healthy, so that you can prevent the bad effect of it, because it is not only your period, your appearance, later on it is your fertility, and later gestational diabetes. When you are pregnant, chance of miscarriage is high, gestational diabetes chance is high, blood pressure, development of blood pressure, preeclampsia risk is high, and the outcome of overall pregnancy will be high if you do not control it beforehand. So my request to all the listeners that if you have a diagnosis of polycystic ovary, of course you need to do these lifestyle modifications and take some medication and take the advice of your gynecologist. But if you do not have the diagnosis of polycystic ovary, but you suffer from some of the problems I've discussed, always just check with your gynecologist and start some lifestyle modification to keep yourself healthy.